So glad you're watching the show on this Monday. What procedure is the best kept celebrity secret? Celebrities have been doing this to maintain their youth, and there's even a medical reason to do it. All right, joining me now is Dr. Doug Henstrom from Utah Facial Plastics to tell us what it is. What is this procedure, Dr. Henstrom?
It's anything that people can do to really help rejuvenate the eyes and taking care of the upper eyelids, the lower eyelids, trying to help you look more refreshed, more awake. And it's a simple procedure, or there are simple procedures that we can do to help with that.
Okay, it's called the bleph.
Yep, blepharoplasty.
Yep. Okay, and look at the before and afters. Look at the difference. And most often you said the comment is, wait, why do you look so refreshed?
Yeah, that's the comment that patients will give us all the time. Here's some examples that are showing that where we've just done upper eyelid surgery. This case, there's a brow lift for a patient where we've lifted the eyebrows. Here's a case where we've done on the left side of the screen, the lower eyelids, taking away the fat bags. On the right side, we're doing just skin removal. So there's a variety of options here for the eyes.
I love that there's a guy in those before and after photos, because men out there, this happens to you too, that skin sagging right down onto like your eyelashes even. Yeah,
in fact, it's even more important for guys to get a good evaluation, because with guys, we can get a really heavy upper eyebrow, and that can sink in. And so for guys, we've really got to evaluate, is it the eyelid that we need to treat, or do we need to lift the brow to help?
Interesting. Do you do a combination of those two things sometimes?
For sure. Yep. Often we'll do a combination. We can do one or the other, or in some cases we'll do both at the same time.
Okay. Is this cosmetic, or is it sometimes medically necessary?
Yeah, both. Certainly a lot of the patients we see, it's cosmetic. They want to change the look. But for certain people, they can qualify for medical insurance to get this covered. You've got to get your eyelids tested, but if your peripheral vision is compromised, then insurance companies will cover this, and we can do it with their help.
It's so true. Sometimes that skin is so heavy, like you can't see off to the side.
Yeah, they'll definitely lose peripheral vision.
Is there an age that you're seeing that has this done more than others?
No, well, 50s and 60s are definitely the most popular age range, but I've done this procedure on patients from their 30s to their 80s. It's a really wide range. People age differently. Genetics is a big factor. This is often a familial thing. I'll see patients who will tell me they had siblings had it done, their parents had it done, and now it's their turn.
All right, so people often have a fear of looking overdone. And this is one of those things I think is almost undetectable, but you just look like you got a great night's sleep.
Yeah, that's the goal, is that when we do this, people get seen, and the comments that their friends are giving them is something's different. I'm not sure exactly what this is. Certainly, we get the comments from patients coming in to see us that I don't want to look overdone. I don't want to have that surprised permanent look on our eyebrows, which we can avoid when we have the experience that we have.
I told you I just had a friend that did this, and I thought she lost 30 pounds. Right? You don't know, like something's different. What is it? You can also, we mentioned the upper, we mentioned the brow, but you can also do that skin pinch that if you have that bag under your eyes, that's the lower.
Yeah. So there's different things that happen with the eyelids as they age. The skin changes. You start to get fat herniating through the lower lids, and that's what gives us the fat bags. We also start to get the hollowing right underneath the eyes, the tear trough deformity. So depending on a person's individual eyelids, we've got to do some things that are different. Do we need to attack just the skin and remove it and tighten it? Do we need to also remove some of the fat that's herniating through? Or can we use some of that fat, or maybe some fat from somewhere else, to transfer into the tear troughs to raise that up? So there's a lot of different options, especially with the lower eyelids. It all comes down to getting the right diagnosis to know how to treat it correctly.
For you individually. All right, downtime is what with this procedure?
Yeah, typically a week. Maybe 2 weeks, not bad. You're going to get bruising, you're going to have some swelling, you're going to have some incisions that are healing. But most people are back to doing kind of normal activities within a week, even if there's still a little bit of lingering bruising.
I have to brag. My friends have all had this done. I mean, they've come to Utah Facial Plastics. They are the best of the best. And right now you have a special offer for our viewers.
Yeah, that's right. If you call in this week and reference this segment on Good Things Utah, you can have a free surgical consultation for any surgery that you're interested in with any of the 3 surgeons that we have at Utah Facial Plastics. We'll look forward to seeing you and have an opportunity to talk with you about your eyelids or whatever else it may be bothering you.
Go in and chat about it.
Let's go.
And maybe they say, wait a second, let's not do that, but how about this? And let's use this product. Free surgical consultation until June 23rd. Mention you saw this on Good Things Utah. Go to utahfacialplastics.com, social media, or give them a call at their 2 locations in Draper and Layton. Dr. Henstrom and Utah Facial Plastics, thank you so much.